Hello guys, this is Brian here with a update/rant video about Blue Cross. Today is March the 31st, 2018. Today is Saturday. And I might be using some language in this video, so if you have kids around, little kids, you may not want them to hear this video. Blue Cross is doing some shitty things. I found out about 2 weeks ago that Texas Health Resources and Blue Cross are in a contract dispute, and if they don't sign a contract by today, tomorrow my primary care doctor and any Presbyterian hospital that I use will be out of network. So how shitty is that? And officially I was notified via email Wednesday, this Wednesday, saying your primary care doctor will be no longer in the Blue Cross Blue Advantage HMO network. You may choose another primary care doctor, but they automatically assign you one anyway, but you can change it. And the way I kind of found out about this, because Blue Cross was not upfront about it, really. I was having a medical complication and had to have a second procedure done on my back. And my pain management doctor is leaving his practice and he's going to go on his own and don't know where yet. And I said, well, you need to join Presbyterian, which is Texas Health Resources. They own between 30 to 50 hospitals and tons of surgical places and all this, and 700 to 1,000 physicians. So they're the second largest hospital system here, behind Baylor, Scott and White. And he said, well, they're in the big giant contract dispute with Blue Cross. I said, are you shitting me? And he said it will be affecting all of Blue Cross, regardless of the plan you have, PPO, HMO, POS. So when I got home that day, I was doing some Googling and then found the actual website. Because it's not really, Blue Cross has not really made it easy to find the information. But they created a website, and it says, if both parties don't come to a contract agreement by midnight today, that Texas Health Resources will be out of network for the whole entire Blue Cross system. Now, this also affects my parents. They have Anthem Blue Cross through their employer. So, even though Anthem don't operate in the state of Texas, they piggyback off of the Blue Cross PPO network. Well, if Texas Health Resources leaves, they have to find a new doctor. So Blue Cross is doing some shitty things, as well as Texas Health Resources. Now, get this. Both companies are non-for-profit, but Texas Health Resources is asking $1 billion in their contract for the next 4 years. I think if I did the calculation right, that comes out to $224 million per year extra. Blue Cross is not going to pay that. They're not. First of all, the Blue Cross in 5 states, they only take in, and what they have now is $10.5 billion in reserves as it is. So no, they're not going to give in to that, to that tactic. And then Texas Health Resources say they don't like Blue Cross's tactics either. They're pointing the fingers at each other. And my primary care doctor's office, I talk to people, and they said this is kind of like a publicity stunt. They think that they do this to get all the patients riled up and make all these phone calls to everybody to force them to sign a contract. Now, I'm assuming that they will sign a contract on the PPO side. I can't imagine a giant healthcare company as Texas Health Resource not take the largest insurer in the state of Texas. I don't imagine that. I do believe that they will on the PPO side. I'm just worried about the HMO side. Baylor Scott Wright did the same thing and did not accept the Blue Advantage HMO when it came out in 2016. The only Baylor hospitals that took it was the main Baylor University Hospital out in Dallas, and the Baylor, 3 or 4 of the Baylor hospitals that were connected with Tenet, which Tenet originally owned. So that's how I was able to get care at the 2 Baylor hospitals for my back and neck, because they were jointly owned by Tenet Healthcare. So I guess I will find out sometime, probably by Monday, because nobody's open on the weekend. Monday to see if I really have to have a new primary care doctor. It's really shitty to put patients like this in the middle. On the form, on the website, it says you can do a continuity of care. Meaning, if you have certain medical conditions that you can qualify, you can still see a Texas Health facility and the doctor. Well, my hand surgeon is also a Texas Health doctor as well, which I'm not concerned one damn bit about that, because my left hand carpal tunnel can wait till the end of the year. It's not really bothering me at all. It's nothing urgent. But I am having a medical complication in right now, and also dealing with new back issues. So therefore, I'm kind of worried about that. The first go-around calling Blue Cross was asking them what happens to the HMO referrals to the specialist that I have on file. Because the primary care doctor is the Texas Health Resources physician. The specialists are not. The 4 times I called, they said the HMO referral becomes invalid. Well, I got hold of a couple different supervisors after calling more times. I don't give up. I keep calling the damn assholes. I do. I keep calling them and calling them and calling them. And they said, no, the HMO referrals does not go invalid. They stay active until the expiration date of the HMO referral. But the problem with Blue Cross is their little video on the website seems to act like they're there to help you. They're not. They're not. See, they call themselves customer service advocates. They're not. Well, the first line of people you speak with, they're not. The third-party contractors, even though Blue Cross claims they're not, but you can tell that the way you ask them questions and they have no idea what the hell you're talking about. So really, their attitude is, fuck you, it's your problem, goodbye. Hang up the phone, it's your problem. And I really detest Blue Cross treating people like this at this time, at this situation. And the people who I really feel sorry for is people who have really catastrophic medical problems, cancer, diabetes, receiving treatment for surgery, whatever the case may be. And they may be in the hospital right now and realize when they wake up tomorrow that the hospital will be out of network. And they could be responsible for balance billing. Hopefully, somebody on the healthcare team, hopefully call Blue Cross and get them to do a continuity of care. And after all this is said and done, I will be filing a complaint with the Department of Insurance the way I was treated. No one at the insurance company has a fucking clue, until I called yesterday, about my continuity of care. I filled the form out. I sent in my medical records I was able to get hold of. And they say it was approved. And they said, well, the new primary care doctor has to send it in too. Well, that makes no sense. The continuity of care is really designed so I can still continue to see my primary care doctor, and the insurance company will pay for the office visits. Now, however, the doctor's office can balance bill me. I asked them 2 different times. They say they won't do that. Because once they go out of network, they can balance bill you. However, on an HMO plan, if something goes out of network, they don't pay nothing. Zip, nada, zero. Only in situations that they will pay a out-of-network provider is an emergency room visit. If you go to in-network hospital and have services performed there, like if you have surgery and the anesthesiologist is not in-network, they will pay them at in-network service level. However, they can balance bill you. That's why it's important to check before you have surgery who's the anesthesiologist. In matter of fact, I do a video about that because the insurance company does maintain a list of the providers at each hospital. And sometimes the doctors who use the anesthesiologists will have a thing with them, even though they won't be in network, they don't balance bill patients. So you have to ask questions about that. So I don't know. I won't find out until I get a letter saying it's been approved and all this mess about continuity of care. So hopefully my HMO referrals are good. That's what I've been told. But it's really a clusterfuck. They're not really being helpful about this. They're putting roadblocks in. And first I was told when I called and asked them, well, how often, I mean, when you change your primary care doctor at the insurance company, when does it become effective? Oh, they say, well, it only becomes effective the first of the month. Well, that's really not true. It becomes effective immediately when you want to change it. Hell, you want to change it 5 times a month, you can change it. See, when you speak to a supervisor, they are the actual employees of the insurance company, not the people who answer the phone immediately. Those people who answer the phone, the first line of people, they don't know shit. So I'm at the point now, for the last week, when I call, I immediately ask for a supervisor. I don't deal with those people on the phone. No. They're not going to fuck me around with my health. No, absolutely not. I make them work for me. I pay a insurance company a premium, and I have to sit here and worry about my health problems, and they're going to fuck me around? Oh, absolutely not. No sirree, Bob. And I found it very coincidental about this fixing to happen tomorrow, Texas Health BI Network, that Blue Cross signed a contract with Baylor Scott & White for the HMO now. So tomorrow, all of Baylor Scott & White and their physicians will be in network. So I'm wondering, did the Department of Insurance watch them doing this? Because if Texas Health leaves, it's not really a adequate network. It's not really. Because essentially you've taken 700 to 1,000 physicians in the DFW area out of the equation. You've taken between 30 to 50 hospitals out of the network. You're taking tons and tons of freestanding emergency rooms and outpatient facilities, surgical facilities out of the picture. So yeah, essentially that leaves a big gaping hole in the network. So I'm wondering, Blue Cross kind of had to force to sign a contract with Baylor Scott & White. Because if they did not, and no one signed a contract with Blue Cross, that really means no hospital system will have been in network. Now, of course, you do have Medical City, which they operate 3 or 4 hospitals around here in the Dallas area. Methodist, they're not very big. But by far, Baylor Scott & White and Texas Health is the largest healthcare providers here. And it's not, and the problem, and another problem here in Texas is, I don't know how it is in other states here, these hospital systems are buying up doctors left and right, like no tomorrow. There is really no independent doctors left, really, unless the doctor themselves form a big group. Like, for instance, the spine doctor I go to, well, there's 5 or 6 physicians in his practice. And they had to do that to survive in order to get them good rate from the insurance company. The only independent doctor that I see is a neurologist for my migraines. He's the only independent doctor that's really left. You know, and what these hospital systems do is they go to these doctors and say, you can keep your practice name, whatever, but we put our computer system in, we put our staff in, and you do what we have to, what we say to do, and all that junk. And they claim that's because the doctors want more negotiation power when it comes to their, getting more money. But I think that the federal government and the state needs to investigate all this and see if it's really beneficial to the consumer. Because Tenet Healthcare, they've been accused of tax dodging because they are a for-profit hospital system. But it's kind of strange, for the last couple of years, they got in cahoots with Baylor Scott & White about 5 hospitals around here so they can become tax exempt. Well, that's tax dodging. And on March the 1st, the 3 hospitals, 4, they didn't do anything with the 5th one. I think tenant went ahead and take it back. But the 3 or 4 ones that were in cahoots with Tenet and Baylor finally bought them out at 100% ownership. See, the doctors were kind of pissed off about that, like my neurologist, because they own the Tenet was partly owned by physicians as well at the hospital. So when Baylor Scott and White took it over because it's a non-for-profit, they were bought out by force, you know, because it's against the law for a non-for-profit hospital to be physician-owned. Well, here in Texas it is. I don't know if it's federal or if it's just state. But I tell you what, it's really shitty about Blue Cross. I think I'll be filing a complaint with the Department of Insurance. Because this exact same thing happened back in 2016, 2 weeks before Christmas. And they did sign a contract. But here it is Saturday, and today's the last day, and I don't know. Hopefully Monday they do something. I'm really thinking that they would do on the PPO, but the HMO, they probably would let that go. And then that really means that Texas Health Resources does not take any Obamacare plans. So they're really fucking people over then, if that's the case. And then you might say, well, you might have a choice in health insurance companies. No, not here. All the major players left except Blue Cross on the exchange. Cigna left. Cigna don't even operate in the state of Texas no more on the individual market. United left. Aetna. For this year, there's only 2 choices on the exchange, was Blue Cross and some off-brand called AM Better Health from Celtic, which no doctor takes. And then no hospital takes except some third-rate hospital that you don't want to put your dog in. And their prescription list is god-awful, so that's useless coverage right there. So you screwed there. Now, I can hop up my employer plan when it comes open enrollment, but then I will have to spend thousands upon thousands upon thousands of dollars out of pocket more than because I qualify for the Obamacare subsidy. So really, there is no choice really, except 2. Either employer plan or Blue Cross. That's it. I really despise Obamacare. I really do. Yes, I've been, of course I've been, benefit from it. Of course I get the subsidy. But what's the real cost of it, though? Narrow networks, yeah. Fewer places to go for healthcare, yeah. Because Blue Cross canceled all their PPOs back in effective 2016 and got converted to HMO on the individual market. Which I don't know how that was really legal for them to do that, because yet they claimed that they lost money, but the net surplus went higher. So go figure that one out. All it is a big fuck you game. That's all it is. It's your problem, fuck you, goodbye. And it's not right. It's not right on part of Texas Health Resources not giving people notice. And it's not right for Blue Cross Blue Shield not giving anybody any notice, except on Wednesday, email saying, hey, your provider will be out of network, choose another one. I'm really disgusted with Blue Cross on how they have treated me in this particular predicament. They need to get their shit together. And if I could, but I don't have any damages yet, but if I can sue them in court, I'll haul their ass in front of a judge and I'll haul their ass in front of a jury who hates Obamacare and spill the beans on Blue Cross, how they turn around, jerk around people, how they turn around and charge people higher premiums. In reality, they're non-for-profit when they should not be charging more higher premiums, and yet they're in the bank with $10.5 billion of our premium dollars. And how you call them and they don't know what the hell they're doing. Record the phone calls. Yeah, I like to sue the hell out of Blue Cross. And I bet you $5 I would win. Because I bet you I could find somebody in that jury who has Obamacare and hates the damn thing. And hates insurance companies, too. And I tell you what, some state regulator needs to look into this crap. And in the State Department of Insurance, in each state, if they got smart and said, if you're not going to participate in Obamacare, and if you continue to pay tactics like this with neural networks and all this shit, we will pull your license so you cannot operate in our state. And then they will straighten up their game then. But we all know what these insurance companies are doing. They're doing Obamacare with neural networks. So they get out paying claims. So therefore, in theory, that will discourage you to go to the doctor. Just like when Obamacare got kicked in. Before then, on my group plan, our emergency room copay was $50. Then all of a sudden, it skyrocketed to $500. Now, is that $500 copay, is that designed to discourage somebody to go to the emergency room? You betcha. Well, I know the numbers game that they're trying to play. And well, I'm thinking what's fixing to happen the next couple of years, if it hasn't already, that they're gonna get rid of the PPOs on the group side. I can guarantee you that, and they're gonna try to get about on the HMO so they can control the cost. That's what's fixing to happen. That's going to be the next nail in the coffin of Obamacare. That it's going to hit the group side. The higher premiums already did it, and the giant copays and deductibles and all that has already done that. But I can guarantee you what's fixing to happen is they're going to get rid of the PPOs because PPOs bleed money. HMOs not so much. Although on the HMO, I have not had any referrals denied so far, and then for the last 3 years. So, but HMO, you have to play their game. You have to stick by their rules, or they won't pay squat. And that's how they get you. And this shit should be outlawed. It does not benefit the consumer one damn bit. But essentially, right now, in 2018, because it is March 2018, fixed to be April, right now, Blue Cross Blue Shield of Texas has become a giant monopoly in the state of Texas. And the state lets it happen. I believe they have really a cozy relationship with the state insurance. They really do. I check every so often, and they have tons of complaints on file. And yet, no enforcement action. Really. See, I see something wrong with that picture. If the insurance companies keep receiving 200 to 300 complaints a year in the state, why is it? And it has to be a pattern of something going wrong here. Oh, by the way, in 2014, Blue Cross received over 1,200 complaints, the highest number recorded in history of the Department of Insurance of any insurance company. And yet, no enforcement action was taken. No fine, no investigation, nothing. And somebody needs to look into that. Another thing that this Texas Health Resources, none of the local media has not said one damn thing. Not one thing. None of the news stations. Now, when it happened in 2016, it was plastered all over the news. So I'm kind of wondering, because Blue Cross advertises on these news stations, these TV stations, do they not want to upset them because of advertiser dollars? I think so. I don't know. Obamacare is collapsing. It's not benefiting anybody in reality. Just like me, there is no choice except one carrier, and that's it. The other carrier, no one takes, so it's just useless. Why would I want to get in that mess? It's just problems at the problems at the problems at the problems at the problems, and I can't stand Obamacare. You paying for shit in your you read your policy book. Take the time and read, just like mine. Why in the hell is there pediatric vision in my policy that I have to pay for? And yet I'm just a single person. So why is that shit in there? It makes no sense. You know, and that's also shitty on the group side too. You paying for other people's benefits on the group side, and that I think the way they really need to go around doing healthcare is the a la carte services. For instance, if I want bariatric services to be covered underneath my policy, I should pay for that. I don't need hearing aids, so therefore that can be excluded out of my policy. I don't need to pay, no need to have that in the premium. Just like when we had a group plan, it paid for in virtual simulation, where they use for people who have trouble conceiving kids. They in vitro simulation, something like that. I know that cost our company lots of money to have that in our premiums, in our benefits. It really did. Just like if you're on the group plan and your insurance company pays for birth control, well, why should the men in the group pay for that out of the paychecks? You see what I'm saying? It needs to be a la carte, and that's how you can really reduce the cost, in my opinion. And I think, kind of like that thing with Hobby Lobby and them, but the federal government was forcing them to pay for birth control when they didn't want to. Yeah, I could see where that kind of falls on the employee part. But my God, birth control, you can go to the local Walmart and buy it dirt cheap, I'm assuming. That's what they say on the news. I don't know. I'm not an expert in that. But, why is the insurance company forced to pay for a $4 or $10 drug? So, therefore, everybody's premiums have to go higher and higher and higher and higher. I don't know. It's a complex problem that I don't think it can ever be fixed. I don't think Obamacare can be fixed. I think they have to scrap the whole damn thing. And I don't know. It is nerve-wracking. No wonder everybody's blood pressure's high. You go to the doctor, hell, they're gonna yank money out of your pocket. So therefore, yeah, your blood pressure's high when you get in there. You know. I don't know. It's just, it is very frustrating. And if you don't speak up for yourself, I have learned that you have to be aggressive. Don't be rude when you call the insurance company. Don't yell and cuss at them. Of course, that won't get you nowhere. But kind of be get aggressive with them. Demand to speak to the supervisor. Tell them how it's going to be, sort of. But don't be ugly toward them. I wouldn't be, personally, if somebody was being ugly to me on the phone, I wouldn't lift a finger to do anything either. But what I'm trying to say is, don't give up. Call 10 times if you have to, like I do, to get a resolution. Just don't give up. I'm telling you what, Obamacare needs to go. I don't know if we end up in a single payer system. I don't know how that will fall apart or not, but it needs to go because there is no competition in health insurance anymore. So therefore, I don't have a choice in reality. Since there is no competition, the monopoly, which is Blue Cross, can raise the premiums up to the sky-high roof, and yet they could justify that by playing bullshit games, and yet their reserves will keep going higher and higher and higher and higher as a non-for-profit. And yet the federal government or the state won't investigate them for that crap. Because probably the lawmakers are probably getting lobby money from them. This video is long enough. Talk to you later.